Hello and welcome to Pune Times Mirror. I'm your host, Prince Chowdhury. In today's episode, we'll be diving into the world of robotic knee and hip replacement surgery with our special guest, Dr. Saurabh Giri, a highly skilled robotic knee and hip replacement surgeon and arthroscopy specialist at Helios Ortho Joint Clinic at Moshi, Shivajinagar, Kokne Chowk, Pimple Saudagar, Bhosle Nagar Range Hills. Welcome to the show, Dr. Giri. It's great to have you with us. Let's get started.
Thank you so much.
So the first question, Dr. Giri, is that what are the common problems related with the hip joint?
See, the common problems with the hip joint is hip is a very stable joint as such. In our population, Indian population, hip problems are not very common compared to the knee issues or compared to the shoulder joint issues. As such, when we see hip problems, there are majorly 2 to 3 types of hip problems. One is arthritis. Then there can be multiple causes of arthritis. Second is most common, which is most common, I'll say, is a fracture in elderly patients, hip fractures. And third is some tendinitis or a joint inflammation, or in a rare cases, a tuberculosis of a hip joint. So most common is arthritis and hip fractures. These are the most common problems with Indian populations. Okay. And there are multiple causes of hip arthritis like rheumatoid arthritis, ankylosing spondylitis. Then there is after post-COVID, the AVN, avascular necrosis of femoral head, which eventually leads to the arthritis. So these are the major problems with the hip joints.
Okay. And these problems which occur in the hip joint and the knee joint, which we're going to talk about today, what age group do they commence from, and until what age group do they stay?
See, for every problem there is a different age group. If you say hip arthritis, which is more common in elderly patient, if it is age-related arthritis, if it is due to some cause like rheumatoid arthritis or ankylosing spondylitis, then it can occur at a younger age group. As I already said, hip fractures are more common with elderly patients. When we see knee issues, if there is a ligament injury, ACL tear, PCL tear, or a meniscus injury, it is more common with active people. That means the younger age group of people.
So this can happen during accidents or fall or something.
Fall or sports injury.
Sports injuries.
Yeah.
Okay.
Yeah. And when we see knee arthritis, it is more common with the elderly group of patients, 55, 60 plus.
Okay.
Yeah.
Geriatrics also.
Yeah, right.
Okay. And what exactly is AVN? If you can tell our viewers what it is.
AVN stands for avascular necrosis. It can happen anywhere. AVN most common nowadays is in hip joint. We have a hip ball called as femoral head.
Right.
Okay. The AVN of femoral head, avascular necrosis of femoral head, is very common nowadays. Why it happens? It happens because, as the name suggests, avascular. Avascular means vessel is not there. Vessel is not working.
Vessel is not working.
That's why the name is avascular. Okay. So hip ball has a very limited supply, very limited blood vessels. Post-COVID, as we all know, COVID used to call blood clots. So these blood clots are getting lodged in those vessels, femoral head blood vessels.
And this is post-COVID you're talking about?
See, if you ask me before COVID, I used to see somewhere around in a month 4 to 5 patients of AVN, whereas post-COVID now the number has gone to 30-40 patients in a month.
That's a huge increase.
Yeah. So it has multiplied in 5 to 6 times. So that's why I am saying post-COVID multiple times.
Right.
Because before COVID the number was not that great.
Right.
And which was a good thing. But post-COVID, because as I said, the virus used to cause thrombosis. That's why we used to give blood thinner to the patient whenever the patient is having COVID.
Right.
But still the blood clots, thrombosis happened. Those blood clots went and they have blocked the femoral head blood vessels. And now the blood vessels are not working. That's why the bone is gradually and slowly dying. And that's why the necrosis. Avascular necrosis. Avascular means blood vessel is not there. Necrosis means bone is dying. So avascular necrosis is most common place nowadays is a femoral head.
I see.
Yeah.
So what are the gradings of AVN and their treatment options?
So the grading of avian, there are multiple grading systems, but one which is commonly followed is there are 6 grades of avian: grade 1, 2, 3, 4, 5, 6. 1 and 2 is when the femoral head involvement is less than or somewhere around 50%. 3 is 50 to 80%. 4 is when your femoral head shape is also changed.
I see.
Fifth is when the femoral ball has flattened and there are some changes in the acetabulum. And sixth is when acetabulum means the cover of the ball as well as the ball is significantly deformed, there is significant arthritis, then it comes in a grade 6. There are multiple grading systems, but this is a broad grading which I am telling you. So now according to the grading, there are different methods of treatment of these condition, that is avian. As I said, grade 1 and 2 less than 50%. That
Right.
means your 50% of ball is still the blood
Functional.
supply is working or is not dead yet.
Right.
So what we can do in this grade 1, grade 2 cases is try and provide the blood supply to that part
Oh.
with some modality which we may discuss later on. Grade 3, grade 4 when the 75% plus
It's a more advanced stage.
more advanced stage. In that case, we need a hip replacement because this modality providing the blood supply or trying to increase the blood supply of that part will not work because already the more advanced stage is there, 75% of the ball is gone.
Right.
Once any tissue is dead, you cannot make it alive again. We cannot be a god.
Yeah.
So
It cannot regenerate.
it cannot regenerate. No tissue can regenerate. Once it is same with the heart. What happens with a heart attack is your blood supply stop and the muscles are dying.
Right.
If we intervene fastly, if we do angioplasty and restore the blood supply, the damage gets restricted, your heart starts functioning and you are okay. Similarly with the bone, if the blood supply is damaged and the affected part is smaller, if we intervene and do something, increase the blood supply, the remaining part will function
At the right moment.
at the right moment. So that's why this grading is important. If you are beyond 2, 3 and 4, then the maximum portion of your bone is already dead. Trying to revive it will not work. So in that cases, we need hip replacement.
So what our viewers would probably also like to know is diet, eating habits, smoking, alcohol. Are these kind of things affect the blood supply, which leads to all these kind of complications?
Yes, absolutely. And a very good question. As I said before COVID, 4-5 patients and post COVID, 30-40 patients. So before COVID, what was the cause then? The cause was either a steroid use, either a alcohol abuse, or you are having blood disease like sickle cell or something.
Right.
So these were the causes. Smoking,
Right.
yes. So in those 5 patients before, the cause was mainly smoking, drinking, alcohol, and steroid use.
Steroid use.
Yeah.
Okay. So when we come to direct anterior approach,
Yeah.
The DAA,
Yeah.
hip replacement, does it help the patient?
So DAA is the way how you do the hip replacement.
Okay.
Direct anterior approach. The name itself explains what it is. Direct means directly.
Correct.
Anterior means front.
Front, correct.
Approach means how you go in.
Right.
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 So direct anterior approach is a approach to your hip joint.
Right.
It is from anterior means
Right.
front of your
front
hip.
portion, correct.
Yeah. And direct anterior means exactly anterior.
Right.
What are the advantages of DAA? You don't cut any muscle in DAA.
You don't.
Yeah. So, and the incision size is very small, somewhere around 5 to 7 centimeter.
Oh, that's
Yeah. So it is a minimally invasive surgery.
Okay.
No muscle cut, incision size is small. So the pain, post-operative pain, recovery becomes faster.
faster. Okay.
Yeah. Most important advantage, I will say, we Indians, we love to sit on a floor. We love to sit on cross leg because that is there in our culture.
Absolutely.
We go to temple, we
Absolutely.
bow down, we sit on a
Right.
floor. If we are going to some function, we will be sitting down.
Absolutely.
We enjoy that.
Yes, yes.
So that is in our culture. So direct anterior approach, what it does, it provides you that flexibility that you can sit down on a floor cross-legged without dislocating your hip.
And without being uncomfortable. Also.
Yeah. So if you do a surgery from a posterior approach, there are 2 ways to approach the hip joint, from the anterior and from the behind, which is behind means posterior.
Absolutely.
If you do a surgery with posterior approach, there are a high probability if you sit on a floor or you sit a cross-legged, your hip joint can dislocate.
You can. That can
Yeah,
happen.
yeah, post hip replacement.
Post.
Yeah, but with anterior approach, the hip joint dislocation after hip replacement surgery is negligible.
Negligible.
It is not possible. The dislocation angle is different.
Okay.
Okay, so that angle we never will never use. I cannot demonstrate you right now, but that angle is of no use. How you the anterior approach hip dislocate,
Right.
that angle we don't use it in a day-to-day life.
Okay.
Okay,
Okay.
it will happen only if you fall down or accident or something.
Right.
So in your day-to-day life, the freedom of mobility, freedom of using your hip anyways is possible with direct anterior approach.
Direct anterior.
So that is the advantage of direct anterior
Okay.
approach.
So what is robotic knee replacement?
Yeah. So there are two types of knee replacement surgery. One is conventional surgery and other is a robotic surgery.
Right.
Knee replacement is a procedure wherein we replace the damaged part of your knee.
Right.
As you grow older, your skin changes. Similarly, the cartilage of every joint is affected, but the knee joint is affected significantly.
Right.
Because of our habits, like as I said, we love to sit cross-legged, sitting
Right.
on a floor and all.
Right.
This causes arthritis of a knee joint.
Right.
Okay. So when the cartilage is damaged, we cannot regenerate cartilage again.
You cannot read.
Yeah. Aging, you cannot reverse aging. Once you have changes in your skin with the age, you cannot become young again.
Absolutely.
Similarly, once the cartilage is degenerated, you cannot regenerate the cartilage.
Right.
So what we do in a knee replacement, we replace that cartilage. We resurface the knee.
Okay.
Okay, it is a knee replacement. I will say it's not a absolutely correct term. It is more of a knee resurfacing.
Resurfacing.
Yeah.
Okay.
So we are resurfacing the knee.
Okay.
We are putting one part above, one part in a below, and in between there is a artificial cushion. Okay.
Okay. Okay.
Which functions like your meniscus. Okay. So that is a knee replacement.
Right.
When it is done with the help of robotic arm, it is called as robotic knee replacement.
Robotic knee. So why should a patient opt for total hip or knee replacement surgery? What are the factors
Yeah.
which actually?
So whenever patient comes to me, I never say that you should do the surgery right now.
Absolutely.
That is my that advice I don't give to any patient.
Right.
I say it is your choice when you want to do it. Because it's not an emergency surgery. Hip replacement is not an emergency. Knee replacement is not an emergency. It's a planned surgery. Why you should plan for this? Because your life is getting affected.
Absolutely.
There are two categories like hip replacement and knee replacement. Hip replacement patients are comparatively younger. They are in 25 to 40 years of age group.
Okay.
So when I see them not just suffering with the hip pain, they have a lot of mental trauma also.
Oh.
Because somewhere in life they are lagging behind because of hip pain. You want to go to job, you want to progress in your life, but the hip pain is holding you back.
Okay.
And that constant daily pain, daily suffering, that I'm not going to some social function because I'm having hip pain, that gives a lot of mental trauma that nobody talks about.
Right.
When patient comes to me with a hip replacement, and normally they tend to avoid a surgery for years,
Right.
2 years, 3 years, and they are suffering for 2-3 years. They are going to one place to other in a hope that someone will heal this, and they are going to a lot of financial troubles as well as the mental trouble. And when they come to me, when I explain them, they go for a surgery, and post surgery, literally, I have seen many patients crying that I should have done this before.
Right.
I have
Right.
suffered a lot and I should have done this before. It has changed my life. So I say, a hip replacement patient, it's just not a hip. It is dragging you in many aspects, social, financial, your family life, everything is getting affected.
Right. Correct.
Similarly, a knee replacement patient. Knee replacement patients, knee arthritis patients are our old age group patients. So when you have someone in your family having a severe arthritis of a knee, if you plan a holiday, you have to plan accordingly.
Absolutely.
Because that patient, you will think whether she will be able to climb the stairs or not, whether she or he will
able
be
to climb the hill or not.
Yeah, will be able to walk in that resort or not,
No,
or
correct.
in a hotel or anywhere.
Right.
Okay, so you then gradually that patient also realizes this, and that patient tries to withdraw himself or herself from that event or from that holiday or something. You go ahead, I don't want to come. Or she will never say, she or he will not say that I'm having knee pain, that's why I don't want to come.
Okay.
They'll say, I don't want to come because I don't want to go. I don't. You go ahead.
They don't want to,
So-
kind of confess that
Yeah.
is the main problem.
Yeah. So gradually they become socially outcast. That okay, there is a wedding, but I'll not come. You go ahead.
Right.
And going for a movie, you go ahead. Will not come.
Right.
So this also affects you mentally, physically,
Definitely.
and most importantly, if you don't walk, you will not be healthy. If you are sitting on a couch every day,
In fact, I was just going to ask you, does a sedentary lifestyle also affect all this?
yeah. So your heart capacity, lung capacity, everything will adapt to your lifestyle. If you are sitting at a one place,
Correct.
doing nothing, your heart capacity will go down because heart doesn't have to pump much.
Absolutely.
So that's why it's not just a physical, it's not just a mental, it affects you both ways.
Right.
Hip pain or a knee pain will bring your physical well-being down as well as a mental well-being down.
Right.
So my advice to every patient is, if it is happening with you that you are getting affected physically as well as mentally, you should go for the surgery. Your life will transform after this surgery. Yeah.
So, if I may tell you that in my case, in my particular case, I was very active before.
Yeah.
So for the past maybe 6 months or a year, I've been very inactive.
Yeah.
I've stopped walking, I've stopped exercising. So my left knee, when I'm walking,
Yeah.
gives me a lot of trouble.
Okay.
It's not a major trouble as far as I think,
Yeah.
but there's pain and there's
Yeah.
discomfort. Even
Yeah.
in the night when I'm lying on my bed,
Yeah.
I get this very uncomfortable feeling.
Yeah.
So do you think this is because I'm not exercising, or should I go for a checkup, or go to see a orthopedic doctor and get checked?
Yeah, I think the first thing to do is never to neglect any kind of pain. Maybe it is not very significant, you are able to do your day-to-day activities,
Right.
but it is giving you some discomfort.
It is.
Yeah. So, to advise to you and every patient is, you should not neglect this. If you can treat this at an earlier stage, then you don't have to go for a surgery or everything. So,
Right.
what I feel, there are many patients like you
Right.
who are not affected significantly. They are having some niggle, some discomfort in day-to-day life. They are doing everything,
Right.
but with some discomfort.
Right.
So my advice to them is to seek a advice,
Correct.
get the investigations done,
Probably
Take
get
up-
a scan done also.
yeah, get a proper treatment done, and follow exercise. Do a good physio or exercise.
Right.
That is what is needed. Yeah.
So if patients come to you, doctor, and they tell you that I have this pain and I have that, and if you think after you do all your tests
Yeah.
that this thing has degenerated to a level where a replacement is necessary, do they kind of say no? I mean, they're hesitant to get that
Yeah.
replacement done.
So that's a good question, and there is a study done by few implants company as well as by the doctors also, that how much time a patient will take if some doctor advise him to go for a knee replacement surgery.
Right.
It was done somewhere around 2017-18. At that point, the average time was 7 years. If I advise someone today to go for a knee replacement surgery, he will never go for a knee replacement.
7 years.
Yes.
By then the knee has deteriorated
significantly.
Wow.
So whenever a patient comes to me for a knee pain with a significant arthritis, if he or she is getting diagnosed for the first time, there are patients, like as I said, 7 years. There are many patients with a knee pain and they'll keep on roaming and then comes down to me. They get convinced very easily and go for a surgery because they know that everybody has advised a knee replacement. Now I am going to a doctor for a knee replacement.
Before it gets worse.
Yeah. But if a patient is diagnosed for a first time and I am advising him or her to go for a surgery, they are very reluctant because there are a lot of misconception, a lot of fear about the surgery. That's why the robotic surgery has came in to improve the success rate, to improve the outcome of a knee replacement surgery.
I see. So what is the major difference between conventional and robotic knee and hip surgery, and what is the time difference? How long does it take to do that?
Okay. So when we do a conventional knee replacement surgery, what we have is zigs
Okay.
and the saw to cut the bone, to give the shape to the bone so that the implant can fit.
Right.
Right? Whereas in robotic, we do a CT scan, we develop a 3D bone model, and then on that 3D model, we decide how much millimeter of bone we are going to cut.
Right.
Yeah. And then we do a bone mapping, and then finally we approve the plan, and then we do the surgery. So that in conventional surgery, we take an average. When we say we are cutting a bone at 5-degree angle, that is the average estimate that a surgeon is making.
Absolutely.
Whereas in robotic, there are sensors attached to your leg, both the bones, and then with the help of that sensor, we say 4-degree of angle. That robo will take exactly 4-degree because there are sensors attached. There are cameras which are detecting the angle and everything.
So it's precise.
It is precise. First is precise. Secondly, whenever we are cutting a bone with a saw, there is a vibration in the saw itself as well as some vibration in a hand. So the bone cutting is not that refined, that precise. Whereas in robotics, we have a miller which does not move. It's a rigid structure and it cuts the bone more precisely.
Wow.
Any industrial cutting which requires precision is done with the help of miller. It is never done with the saw.
Oh my God.
So that precision is brought now in a surgery. With the help of a miller, we cut the bone. That precision comes with the miller, and accuracy of 1-degree, 1 millimeter is possible with robotic. Third advantage of robotic compared to conventional is when we do a surgery with conventional, we have to put a intramedullary rod in your bone marrow. We open a bone marrow, so there is a bleeding. Whereas in robotic, we don't do that. So the bleeding is less. This is the advantage of robotic. You said time. I'll say when I do a conventional surgery, my time is less. I do it in somewhere around 30 minutes.
Right.
Whereas when I do a robotic surgery, the time is more. Absolutely, because 45 to 50 minutes,
Right.
it is going to be more, because we are doing a bone mapping. Every single point we are checking, doing bone mapping. Then there is a mean calculation whether the points taken by me is absolutely correct or not.
Right.
And then the final pan approves, and then the miller cuts. There is a movement of a robotic arm which is happening. You can move your hand like this, but robo will never move like this. Yeah. The robo will move like this smoothly.
Much more smoother.
Yeah. So that's why the time taken by a robotic is more compared to the conventional, but it brings in a lot of advantages to it, because the bone cutting become precise, the results are become more accurate, and your recovery and the success rate of a surgery goes high. With time, every surgery becomes more refined, more better. So conventional surgery is not a bad surgery. Robotic is a more refined and more precise version of a conventional surgery.
Precise version.
Yeah.
Dr. Saurabh Giri, thank you so much for taking time off and speaking with Pune Times Mirror. It was a pleasure to have you with us.
Thank you. Thank you so much.
Thank you.